Hey, happy weekend, everybody. I'm going to give you a little something more to think about today. So, I was talking with a patient recently about how he's doing with the buprenorphine, and he is taking more buprenorphine than we had agreed to. Running out early, this is a real common problem that patients who are in the buprenorphine program have. And so he's been in the program for a long time, has been doing really well. And so we're just kind of talking about what is driving him to take more buprenorphine. And it reminded me of another patient because when I was talking with this patient about overusing the buprenorphine, he really didn't have a good explanation for it. He's like, I don't know, I just take more. And it reminded me of a patient that I've really learned a lot from. And so this patient was relapsing off of the buprenorphine back to heroin or oxys or something. And I said to him, why are you, what is going on? He goes, well, because I'm an addict and that's what addicts do. Which is technically accurate, but it seemed to me that what he's done there is kind of build this wall between himself and his chemical dependency. And isn't really reaching in there and really kind of unpacking what it is, what he's feeling, what thoughts he's having. So for this patient who's doing well but still tends to overuse the buprenorphine, I said, why don't you write down what it is exactly you're thinking and feeling when you're thinking about taking another buprenorphine, even if you end up not taking one, or when you do, like what is it that's driving you? What are your thoughts, etc.? And I think fundamentally, pacing yourself with the buprenorphine, taking exactly what you should be taking every day, never more, never less, is a training program for the rest of your life. Because it turns out that you have a whole bottle of buprenorphine at home. And the only thing stopping you from overusing it is you. And once you're off of buprenorphine, the only thing stopping you from using opioids is you. And so controlling the buprenorphine, getting to that point where you're thinking about taking another dose, talking yourself through it, understanding yourself, unpacking what drives you to take more buprenorphine is a critical step for the rest of your life, as opioids are out there, heroin is out there. There's nothing, necessarily that's going to stop you from relapsing other than the skill set that you develop while you're taking buprenorphine. You're pacing yourself, you're tapering down, you're gaining control, and you're managing this chronic relapsing disease that's killed so many people. When you're managing your buprenorphine well, you're pacing it well, and you're gradually tapering down, that's an enormous success. And that shows a lot of control over the chemical dependency, a lot of good coping mechanisms. When people are overusing their buprenorphine on a regular basis, that's certainly concerning because obviously, they're at high risk for relapse if they were to go off of the buprenorphine, because they're still, their brain is like more chemical, and I'm not feeling good, more chemical is going to solve my problems. And that, may not be exactly the words that are going on in that inner dialogue, but that's essentially, what we need to kind of unpack is what is the problem that's going on? How are you feeling? Is it just physical craving? Is it an emotional state like anxiety or sadness or just feeling underappreciated or just feeling shitty about whatever? Or, is it that you're having pain? Is it, what's going on? Because at the end of the day, when people overuse buprenorphine, they've given themselves permission to take that extra dose. They do it knowing full well what's going on. And so, how do they give themselves that license to take that extra dose? What is it? What are the steps? If you write it down, if you understand it, then you can start to manage it. If you're like the patient that I told you about who said that I'm an addict and that's what addicts do. If you say, I take extra buprenorphine because I'm an addict and that's what addicts do, well, that may be technically accurate And I really don't like the term addict, but anyway, that's what he said. The problem is that that doesn't lead you to the next step of, well, now what? You know, you'll be chemically dependent for the rest of your life, right? But, you know, when you're overusing your buprenorphine, you need to examine that. Build the skill set necessary to control it and eventually taper off. That's what this whole program is about, is giving you this opportunity to gain the skill sets necessary to manage the chemical dependency for the rest of your life while the buprenorphine keeps you out of withdrawal. That's all that it does. But it is an effective tool, because if you're given 60 a month, you know, and you're taking 60 a month, boy, you've come a long way. If you're given 60 a month and you run out a week early, you know, you've got some work to do. And it's not just crossing your fingers and hoping for the best. It's, okay, what is going on? Write it down, think about it, examine it, solve it for the future for yourself. Anyway, those are my thoughts for this week. I'll try to, give you a few thoughts per month, and for the 2 or 3 of you that actually watch these videos, thank you so much. I appreciate your comments if you have any, and good luck.